The views expressed on the Jerry Cahill CF podcast are that of Jerry Cahill and guests, and not necessarily those of the Boomer Esiason Foundation. Nothing on the Jerry Cahill CF podcast should be considered medical advice. Such advice can only be given by a physician who is experienced with cystic fibrosis. The Boomer Esiason Foundation, Jerry Cahill and guests cannot be held responsible for any damage which may result from using the information on this podcast without the permission of your medical doctor. You're listening to the Jerry Cahill CF podcast presented by the Boomer Esiason Foundation and jerrycahill.com.
Welcome to Jerry Cahill's Living, Breathing, Succeeding podcast series. This show, Managing CF-Related Diabetes, was made possible through an unrestricted educational grant from Gilead to the Boomer Esiason Foundation. Today you will meet Sara Yourman, 29 years old, from Fair Lawn, New Jersey. Sara was diagnosed with cystic fibrosis at 19 months, type 1 diabetes at age 8, and Chrohn's disease at age 11. Sara graduated with a Bachelor of Fine Arts from Keene University in New Jersey, and from there she pursued a Bachelor of Science in Dietetics from Montclair State University, and then completed her registered dietitian internship through Meredith College in North Carolina. It's an honor to be speaking with Sara today, a patient advocate, an athlete, and health professional.
Hi, my name is Sara Yourman. I'm 29 years old. I have cystic fibrosis and type 1 diabetes. I was diagnosed at 19 months old with cystic fibrosis. I grew up a relatively normal life. I skied from the age of 2 until current. I have a younger brother with cystic fibrosis as well. As of now, I am a registered dietitian and I work with kids with type 1 diabetes. I really enjoy my career because it's giving back to everyone who's given to me throughout my diagnosis since I was 8 years old. And it's the patients understand where I'm coming from and I understand where they're coming from as well. Diabetes is either insulin resistance or your pancreas makes little to no insulin at all. Type 1 diabetes is when the pancreas makes no insulin. And type 2 diabetes is when there's stress on the pancreas and it's not able to make enough insulin. Resistant is more associated with type 2 diabetes, where there's stress on the pancreas, where through diet and exercise, it can start producing insulin again. CF-related diabetes is usually caused by a stressor. So if you're on steroids or post-transplant, because it's causing a lot of stress on the pancreas. I have type 1 diabetes and I manage it through an insulin pump and a continuous glucose monitor called a Dexcom. I have been on an insulin pump since I was 11 years old, but the biggest advancement for me was having a continuous glucose monitor, because you can see that if you're on steroids, different times of the day of when the steroids kick in, and you can adjust your underlying insulin based on your blood sugars during the day. Some people with diabetes use a sliding scale, which is a range of either blood sugar numbers or a carbohydrate amount to give a specific amount of insulin. The general rule is to bolus or give insulin about 8 to 20 minutes before eating. The peak time of insulin is about 15 to 30 minutes. So you want to make sure that your insulin is peaking as you're starting to digest your food. Usually the normal range for someone with diabetes is for your blood sugar to be between 80 and 120. Sometimes it rises due to food intake or stress on the body. When somebody with CF goes on prednisone or a different type of steroid, it causes your blood sugars to be elevated, and usually you need to take more insulin for food that you're eating because of the additional stress that it's putting on your pancreas. People with CF-related diabetes can also maintain a healthy diet and continue to gain weight and maintain their weight as well. They just have to think healthy and smart about the different foods that they're eating. Whole grain carbohydrates, which elevates your blood sugar not as fast. Or peanut butter, so it has high fat, protein, as well as some carbohydrates. Carb counting with diabetes is following the amount of grams of carbohydrates per servings in different foods. It causes your blood sugar to be elevated, and you take insulin based on the amount of carbs that you eat. Having CF-related diabetes can be a big problem as far as if you don't take care of yourself, because Higher blood sugars can cause more frequent infections. When I go in the hospital for CF exacerbation, I make sure the nurses are aware that I am on an insulin pump and that I check my finger sticks or I have a continuous glucose monitor, because sometimes I do both. But I always make sure that the nurses know that how much insulin I give for meals, as well as what my blood sugar is at mealtimes. Some of the complications with uncontrolled diabetes can be numbness or tingling in your hands and feet. You could have eyesight issues due to the nerves in your eyes, and it also can affect your kidneys and having them work properly. Exercise is really positive for people with diabetes, but you do have to make sure that you carry glucose gels or glucose tabs, as long as granola bars with you, because you don't want your blood sugars to go low while you're exercising. Some of the side effects of low blood sugars can be shaky, you're dizzy, you can sweat a little bit more, as well as the extremes where you can black out or you can go unconscious. So that's why it's really important to maintain and monitor your blood sugars. Having diabetes, it is really important to have your support system, because it is a 24/7, 365-day-a-year disease, and sometimes it can get really frustrating. It is important to have somebody who you can talk to or understands what's going on. For me, working and going to diabetes camp, I have a group of friends with diabetes, but I also have my family, my friends, and my boyfriend who are there for me when I need them. When I was diagnosed at 8 years old, CF camps were phased out, so I found diabetes camp, and I was lucky enough that they would also take care of my CF treatments. It helped me a lot create friends that understood at least half of what I was going through. Being a registered dietitian has helped me be more intuitive into healthy eating, exercise, and helping with my diabetes regimens. It also gave me the opportunity to give back to everybody that has helped me along the way, and I'm able to connect with my patients and understand what they're going through. A very personal quote to me that I created very early on is, "A normal life is whatever life you lead that brings satisfaction to you and inspiration to others." Having CF, diabetes, and Crohn's, it's a lot put on me, but I always tell everybody I don't know life without it, because I was diagnosed at such a young age, and I just continue to work it to my advantage. I have a boyfriend, I ski, I exercise, I go shopping with my friends, and I just wait for the next stage of life.